how much does home care cost? And it really depends. So in home health, which is kind of the medical branch, which is nursing and physical, occupational, and speech therapy, and medical social worker, that sort of thing, oftentimes that's covered at 100% by whatever insurance you carry. And that typically is just temporarily, short periods of time. If you've been, had an injury or a surgery, or there's a disease process, you've been like an illness and that sort of thing, and you just come back home from the hospital or skilled nursing facility, they typically will provide home health. Now, hospice is also kind of under this umbrella, and a lot of people ask, how much does hospice cost? And most of the time, I'd say 99.9% of the time, that is covered under your insurance. And so most people who are on hospice are of a Medicare age, and so even if you're on a Medicare Advantage, you convert back to, and at least in the state of Missouri, you convert back to traditional Medicare, and that is covered 100%. And that covers several different things. You've got nursing, chaplain, medical social worker, a bath aide. It covers a lot of diagnosis-related pharmacy is covered by the hospice. The medical supplies are covered, and then any medical equipment, a hospital bed, oxygen, a whole host of things are covered by the hospice program. Now, then there's home care. Some people will pay for that privately per hour, and they're hiring an aide to come in, and we specially train aides to take care of folks in their home, and they're having someone come in and do like housekeeping and personal care, like work baths and that sort of thing, and helping them get up in the morning. We're really providing support services so that individual doesn't have to require a higher level of care, like a more expensive, costly nursing home stay and that sort of thing. And then there's also Medicaid services that can be provided, and typically Medicaid costs are, those services are covered by Medicaid at 100%, so there's no out-of-pocket on that. Now, private duty can vary by state a lot, and so it really just depends, but I would say, generally speaking, that cost is usually the same as the Medicaid rate in that state, which in Missouri, that's around $30 an hour. And so it can be quite costly to have to get that extra support in the home, but that $30 an hour, if you need just a few hours a day, although that does add up, it's nothing compared to the cost of needing to do a higher level of care like a skilled nursing facility. So it's a good investment for most families to do a little bit of home care in order to avoid that higher level of care.